All right, welcome back everyone. Our next presentation is from Royal Perth Bentley Group, and we've got Marie Yearwood here to speak to you about the programs that they offer. Thanks, Marie.
Thank you. Thanks, Natalie. Hello everyone and welcome. I'm sure you've been very much enjoying your morning so far and you're probably feeling all a bit overwhelmed by the choice out there. Okay. I would just like to start by an acknowledgement of country. I acknowledge that this land that I live and work is on the Whadjuk country and that the Whadjuk Noongar people of Perth are the traditional owners and custodians who have a rich social, spiritual and historical connection to this country, which is as strong today as it was in the past. Okay, so the Royal Perth Bentley Group is part of the East Metropolitan Health Service. There are two hospitals in the RPBG group. That is Royal Perth Hospital, which is an tertiary adult healthcare service. Royal Perth Hospital is home to the State Trauma Centre, Major Trauma Centre, so we get all of the trauma from the metropolitan area comes to Royal Perth Hospital. And there's a new innovation that they've started this year called the Health in a Virtual Environment Service, or HIVE. And what HIVE is it's a remote monitoring service for patients that's at Royal Perth and at Armidale. It uses an artificial intelligence platform that detects the earliest signs of clinical deterioration. So some of the wards at Royal Perth and some at Bentley have what they call HIVE beds, where patients have monitoring. So from the patient's perspective, there's someone there keeping an eye on them, and also the nurses can speak to specialist critical care staff who are there 24 hours a day, medical and nursing, if they have concerns about their patient. And that's been very innovative and so far has been working extremely well. And the focus of the HIVE program is to improve patient care and patient safety. And that program is unique to the Royal Perth Bentley Group. Okay, so why would you choose Royal Perth Bentley? Okay, we believe we provide you the best start to your nursing or midwifery career. Okay, we're a flexible and supportive employer, and we will provide you with a wealth of experiences and knowledge. At Royal Perth, we employ both graduate registered nurses and graduate enrolled nurses. Bentley Health Service employs graduate registered nurses, midwives and enrolled nurses. All of our graduate programs are evidence-based. Okay? The research on graduate programs is reviewed and changes are implemented. We undertook a major review of the literature in 2014 and 2020. We do seek contribution from our graduates, and we actively seek their feedback through both formal evaluation tools and informal tools. We use the feedback that we receive from our graduates to inform refinements to the program and to meet the needs of the health service. Okay, based on the evidence, based on the literature, we've identified key features of graduate programs, and this is what we have in our graduate program. Firstly, support. Graduates need help to feel welcomed, to feel valued, and to develop a sense of belonging to the organisation. Socialisation. It's a process by which graduates acquire knowledge, skills, and an occupational identity with the profession of nursing. And lastly, facilitated learning. We do this through graduate induction, plus ongoing education and development. We have regular graduate education sessions, so 1 hour sessions offered each fortnight, 20 over the year, and we have 2 graduate-specific study days. We offer one after about 3 months that you've been in the program on management of deteriorating patients, and that contains a practical component, so we're looking at your skills in managing a patient who may be deteriorating. And then later in the year we offer one on management of challenging behaviours, because we do see a lot of patients who do display behaviours which are challenging and we do need support to manage. So in 2022, we know that we have a program commencing in February 2022. It is likely that there will be a second graduate intake later in 2022, but this is yet to be confirmed. But we do know that all communication for any future graduate program at the Royal Perth Bentley Group will be through Grad Connect. Okay, so always use that as your reference source. For our registered nurses, we offer 2 6-month rotations. Generally, medical surgical or a general area and then a specialty area. Our medical areas include general and specialty medical, also including areas such as our acute medical unit, which is a very large 53-bed acute medical transition unit where patients come from emergency, are then sorted and either discharged home or sent to another medical area. Challenging but very worthwhile area. Surgical areas include trauma orthopaedics, trauma neurosurgery, the acute trauma, the trauma unit itself, day surgery, general surgery and plastics. So big range of specialties. Our other specialty areas is we offer graduates the opportunity to do 6 months in the emergency department. We offer the coronary care unit / cardiology ward. We offer the intensive care unit. We offer the imaging department, recovery unit, the endoscopy suite, medical day unit where nurses become skilled in cannulation and in administering cytotoxics and very, very specialty drugs. And we also have a very limited number of places in mental health. We have 1 mental health ward at Royal Perth. We also offer a 12-month program in operating theatre. Okay? The operating theatre programs are just 12 months in operating theatre. The graduates there do 4 months in 3 different theatre specialties. So I think they do general, orthopaedics and plastics. So people who are interested in that, it's a very good program. Obviously, that's only limited numbers that we take to operating theatre. Okay, for our enrolled nurses, last year we changed. We now offer our enrolled nurses 12 months in 1 clinical area. Okay, the reason we made that change is that we appreciate that our enrolled nurses have not had the clinical exposure and the clinical experiences that the registered nurses had, and we really want to emphasise the importance of skill consolidation, okay, and becoming confident in their skills. So the clinical areas they go to: medical, same, general and specialty medical; surgical, same as the registered nurses; trauma, orthopaedics, neurosurgical, the trauma unit, general surgery, plastics; mental health. We offered our enrolled nurses operating theatres this year. Obviously a very small number went to operating theatre, and we also offered the imaging department. So you can see that we have a diverse range of placements for our registered nurses and for our enrolled nurses. At Bentley Health Service, like Royal Perth, their program commences in February 2022, and as with Royal Perth, it is very likely there will be a second graduate intake in 2022, but the date is yet to be confirmed. Okay. Bentley Health Service has a number of variations in their grad program, and that's because they have a large component of mental health as well as general and rehab other beds. So one of the first options is a 12-month mental health program for registered nurses only, and like the North Metro mental health that we're talking about, that program is in partnership with Notre Dame University, and it's 2 6-month rotations in specialty or acute and less acute mental health areas, and graduates are funded to complete 2 units of a graduate certificate in mental health. So if that's something that you're interested in, you're getting 2 units paid for by somebody else, which is fabulous. They start a couple of weeks early in the grad program, and they do 2-week study leave at the start of the program. We have a 12-month mental health program for enrolled nurses, which is 2 6-month rotations. We have a 12-month comprehensive program for registered nurses and enrolled nurses. So our registered nurses do 6 months mental health, 6 months general, and our enrolled nurses do general for 12 months. They also offer a perioperative program at Bentley for registered nurses, and they offer a 12-month graduate program for midwives, which is likely to be starting up again next year. I would like to share with you some of the common questions that we get asked as graduate coordinators. Okay. First one we often hear is, if I want a graduate program at Royal Perth or Bentley, do I have to place those hospitals first on GradConnect? Yes, you do. Both those hospitals will fill their places by the end of round one. Okay, so if you want either Royal Perth or Bentley, then you need to put them first. I believe on GradConnect you select RPBG as number one, and then you can tick whether you want Royal Perth or Bentley as your specific site that you wish to go to. Another question we commonly get is, what happens after my application goes into GradConnect? We will send you an email to let you know your application has been received. Okay, so at least puts your mind at rest and your heart at rest that it's okay, you know that we've received your application, because we know how much work that you put into your applications. Nadine and myself and Corrine at Bentley, we then read all the applications. Okay, we don't choose not to read some, we read all of them, we assess them all, and then we will contact you if you are shortlisted for an interview. If you are shortlisted for an interview, what we will do is we will send you out a survey on SurveyMonkey, where we will get some feedback from you on what clinical rotations you've had, what experiences you've had, and also let you share with us what clinical areas you're interested in working in. Okay? And then when we set up our interview schedule, we interview based on areas of preference. Okay, so if you say you're interested in operating theatre, as an example, then we'll try and group them together, you know. How many graduates do we take? That's a common question we get. Like everyone else, we don't declare numbers. For one thing, they often change, so we could tell you a number now and I can tell you by next week it might be a different number. If you really want a graduate program at Royal Perth Hospital or at Bentley Health Service, then you need to place us as your first preference. Next one, can I request clinical areas? Yes, as I said, if you're shortlisted for an interview, we'll send you out a survey and we'll ask you what areas you're interested in. So we do take that into consideration, and we'll look at that in conjunction with what experiences you've had in your undergraduate program. How do I get a placement in Royal Perth Hospital ICU or emergency department? Yeah, those are popular placements, and the grads who get the opportunity to go there really enjoy those opportunities. It's based on a few things. It's based on the quality of the application that you submit to us. It's based on your performance at the interview when you come. But we also look at your clinical experiences during your undergraduate studies. Okay, we've got to make sure that this is an area that you're going to be able to get a lot out of that opportunity. What happens at the end of 12 months? Obviously, we're offering you a grad program, but people want to know, am I going to get a job afterwards? Royal Perth is very supportive. Okay, we've put a lot of effort into training you and developing you as graduates. We don't want to lose you. Okay. We have a process which is specific for graduates, and in terms of an ongoing employment process. We either offer short-term contracts. It really depends on the clinical area you're interested in going to. But either you're offered a short-term contract, or in some cases, some of our graduates at the end of their programs in February this year actually got permanent contracts. Okay, so it really depends. For some graduates, they want to try somewhere new. Okay, they've done trauma neurosurgical and they've done a medical ward, and they want to try cardiology or they want to try emergency. So obviously you're not going to get a permanent contract in those placements, but you may get another short-term contract. Okay, it really depends on what that clinical area has available. Can I work part-time? Our grad program currently, our graduates are working 5 days a week. There is scope to reduce a little bit, but Not a huge amount. You certainly can't reduce to 2 or 3 days a week. There's just a huge amount for you to learn, to become confident and competent in, and that takes time. So we really need you to be there. So we are flexible and we do negotiate. We do have some clinical areas that are not shift work. So if that's something that's important to you, that, you know, for your life and other things outside of work, you know, regular hours would suit you, tell us that. For example, the medical day unit, where they're doing cannulation and administering cytotoxics and things, that's a Monday to Friday. You know, likewise, recovery is also regular shifts, but for the wards, they're all shift work and working weekends and working night duty and etc. Okay, so in summary, our programs are 12 months, commencing in February 2022, but it's likely we will also have a second start date. The key components of our program are support, which we do through our induction program. We have an intense support period at the beginning to help you to settle in, socialisation of our graduates, and ongoing learning and study days. And please come to the Royal Perth booth, the Royal Perth Bentley booth, and come and meet with our coordinators, Corrine, myself and Nadine, and our grads. We've got some grads who are here as well, so we'd love you to talk to them and hear about what their experiences are, because they're our best salespeople. All right, thank you.